22-year-old Kat collapses and is rushed to the emergency room at 26 weeks pregnant. Doctors perform an urgent ultrasound to monitor the fetal heart rate and scan for abdominal fluid. Kat's blood pressure climbs while her glucose levels drop. A biopsy confirms acute fatty liver of pregnancy. This rare enzyme deficiency causes rapid, life-threatening liver failure. The medical team initiates an emergency C-section to save the baby, but the procedure triggers a physical catastrophe. Inside the operating room, Kat's liver ruptures under the internal pressure. Blood saturates the surgical field. Surgeons attempt to pack the wound, but Kat enters DIC, a condition where her blood loses the ability to clot. She begins bleeding from her nose and the surgical site simultaneously. Her liver is functionally destroyed. The lead surgeon realizes she will not survive the hour without an immediate transplant. Outside, Kat's mother waits. Earlier, Kat had demanded she leave the room, blaming her mother's presence for her own feelings of failure. Now, the surgeons inform the mother that a deceased donor will not arrive in time. The mother intercepts the doctors in the hallway. She states her blood type and confirms her health status. She demands an immediate living donor transplant. She refuses to move until they agree to take a portion of her liver. The woman Kat tried to push away is now the only person capable of keeping her alive. The mother is prepped for surgery, forcing the medical team to bypass the standard registry to prevent a double fatality. A tactical drug bust transitions into a violent ambush. Radio dispatch confirms multiple targets are in custody, but the situation at Target 16 collapses. Gunfire erupts. An officer goes down. Amid the chaos, Jo realizes the operation was compromised from the inside. She flees the scene, moving through the shadows to avoid detection. She meets Dr. Dylan Scott in a dimly lit parking structure. The air is heavy with suspicion. Jo reveals the brutal reality. A mole exists within the Chicago Police Department. Someone on the force tipped off the gang members, allowing the high-ranking targets to escape. Jo's undercover identity is no longer a secret. She has been made. To survive the next 24 hours, she must vanish. She carries a bag of secret funds, the price of her disappearance. Dylan offers a secure location, a place where she can hide from both the criminals and the corrupt police officers hunting her. There are no goodbyes, only the cold logistics of survival. She finally gives Dylan her real name, Jo. She steps into the dark, abandoning her old life to go completely off the grid. The city lights flicker in the distance as she prepares for a life where she no longer exists on paper. Every shadow is a potential threat, and every siren is a countdown. Her only objective is to stay invisible until the internal rot is purged. She is now a ghost in her own city. Officer Sam Devers arrives at the emergency room with a gunshot wound to the lung. The trauma team works to stabilize his breathing. An X-ray is performed to locate internal damage. The imaging shows a bullet lodged deep within the right hilum, dangerously close to the pulmonary artery. The medical team notes a critical discrepancy. The physical exam shows one entry and one exit wound, yet the scan confirms a projectile remains inside his chest. Dr. Choi and Dr. Scott obtain the police body cam footage to reconstruct the shooting. They play the video in slow motion, frame by frame. The footage records only one muzzle flash and a single gunshot. There is no second shooter and no second shot. The doctors return to Sam's bedside with the evidence. Faced with the facts, Sam confesses. The bullet near his heart is a 20-year-old secret. He never reported the injury to avoid being disqualified from the police force. The new trauma has caused the old bullet to shift. It is now creating a pseudoaneurysm in his pulmonary artery. If the vessel ruptures, he will bleed out in seconds. The doctors offer a choice between a conservative procedure and a radical thoracotomy. Sam's wife, Alice, watches the recording of her husband's near-death moment on a laptop. She sees the reality of his hidden life. She rejects the safer, career-ending option and signs the consent for the high-risk surgery. The surgeons prepare to open his chest to remove the 20-year-old threat. Julia Lambert arrives at the hospital to perform the ultimate act of devotion. She is scheduled to donate a kidney to her boyfriend, Owen, who suffers from polycystic kidney disease. To Julia, this sacrifice is the foundation of their future. To Owen, it is a transaction for survival. Behind closed doors, Owen pulls the doctor aside. He delivers a cold confession. He no longer loves Julia. He intended to break up with her months ago, but the transplant offer changed his mind. He is staying in the relationship only to secure the organ, planning to leave her the moment he recovers. Dr. Hannah Asher uncovers this deception and confronts the ethical nightmare. She refuses to clear Julia for surgery, citing the psychological trauma of such a betrayal. The secret is revealed. Julia stands in the hospital room, staring at the man who is prepared to take a piece of her body before discarding her. The atmosphere turns suffocating as the reality of Owen's plan sinks in. He admits he was waiting for the right time to end it, but the right time was always after he was safe. Everyone expects Julia to cancel the procedure and leave Owen to the transplant list. Instead, she makes a calculated decision. She looks Owen in the eye and tells the doctors to proceed. She isn't doing it for love. She is doing it to save a life and settle a debt he can never repay. She undergoes the surgery, giving him her kidney and simultaneously stripping him of his leverage. Julia leaves the hospital with one less organ, but she has bought her freedom. Owen has his life, but he will carry her sacrifice as a permanent reminder of his own cowardice. Pamela, a premier surgeon, prepares for her own cervical spine procedure. She hands her power of attorney to Marcel, a fellow doctor and her partner. This choice is rooted in absolute trust. During the operation, the situation turns critical. A vertebral artery ruptures, causing massive internal bleeding. The lead neurosurgeon identifies a path to save Pamela's career, a high-precision repair using an exoscope to suture the vessel. This is the only way to preserve her fine motor skills. Marcel watches from the observation gallery, consumed by the risk of her death. He ignores the surgical recommendation and intervenes. He invokes his legal authority as power of attorney to veto the repair. He demands the team stop the reconstruction and instead ligate the artery immediately. The neurosurgeon warns of a potential stroke, but Marcel insists on the safest route to keep her alive. He orders the use of hemoclips to physically block the blood flow. The clips are applied, and the bleeding stops, but the vessel is permanently sacrificed. Pamela wakes up in recovery. When asked to perform a simple coordination test, her hand trembles and misses her target. The test confirms a cerebellar stroke. She has lost the steady hand required for surgery. She discovers that the decision to ligate was not a medical necessity, but a choice made by Marcel. The person she trusted to protect her future has ended her career. A genius surgeon is left with a permanent disability, destroyed by the very man who claimed to be saving her. Dany stalks Dr. Sarah Reese outside the hospital gates. When she confronts him, he admits the woman with him is a trafficker, not his mother. He is a victim of sex trafficking, controlled by a forced heroin habit and a microchip implanted in his right side. This biosensor allows his handlers to track his coordinates at all times. Dr. Reese offers medical detox and police protection. Dany refuses, citing the trafficker's intelligence and reach. He flees the scene and disappears. Hours later, an emergency call brings a 19-year-old male into the trauma bay. It is Dany. He has a massive, jagged laceration on his flank. In a desperate attempt to disable the tracking device, he used a blade to cut into his own body. He carved through layers of skin and muscle to remove the chip manually. He is in hypovolemic shock, having lost a significant volume of blood. His clothes are saturated. As Dr. Choi and the surgical team struggle to control the hemorrhaging, Dany remains conscious and terrified. He tells Dr. Reese he tried to cut the chip out because he wants to live. He pleads for help, stating he must get away from his captors. The medical staff works to stabilize his vitals. While the reality of the situation settles in, the boy mutilated himself to achieve a few minutes of invisibility. He is no longer just a patient, he is a witness, fleeing for his life. Haley arrives at the emergency room with severe jaundice and a failing liver. Chemotherapy has triggered acute liver failure, causing her brain to swell. Dr. Manning and the surgical team attempt to manage the intracranial pressure, drilling into the girl's skull to insert a drain. The monitors scream as Haley's heart stops. Manning performs chest compressions, but there is no response. She stops the clock and calls the time of death. The parents collapse in grief while Manning stands over the body, witnessing the total failure of modern medicine to protect a child from its own treatment. Later, Manning walks into a residential basement. Shannon and a group of teenagers have turned the space into a functional laboratory using discarded medical equipment. They call themselves biohackers. They operate at a BSL-1 safety level, sequencing DNA and culturing cells in makeshift incubators. Shannon shows Manning an apple slice implanted with human cells shaped into the form of a human ear. They are engineering their own solutions for hepatitis C and other diseases. When Manning asks about non-Hodgkin's lymphoma, Shannon explains the cellular mechanics of the blood cancer with clinical precision. This is the exact disease that killed Haley. In this damp room, the children are attempting to solve the mystery that the hospital's billion-dollar infrastructure could not. One life ended on a sterile surgical table, but a new attempt to bypass death is happening in the shadows. The contrast is absolute. The hospital provides a grave, while the basement provides a prototype. Dr. Choi supervises a Navy corpsman as they treat a teenager named Marco. Marco has a gunshot wound to the chest. His lung has collapsed, creating a tension pneumothorax. Trapped air is crushing his heart and blocking blood flow. Choi directs the corpsman to perform a needle decompression. They drive a large bore needle into Marco's chest to release the pressure. Marco's vitals stabilize. Once conscious, Marco refuses to cooperate with the police. He stares at the ceiling and vows revenge against the rivals who shot him. Later that evening, a 44-year-old mother is rushed into the emergency department. She was watching television with her children when a stray bullet from a street shooting pierced her house and hit her in the chest. She arrives in cardiac arrest. Choi performs an emergency thoracotomy, cutting open her ribs in the trauma bay. He applies an aortic cross-clamp to redirect her remaining blood to the brain. He massages her heart by hand, but the monitor remains a flat line. After multiple rounds of internal compressions and adrenaline, the heart fails to respond. Choi calls the time of death at 15:42. A police officer arrives with news about the shooters. The suspects are associates of Marco, the boy Choi saved hours earlier. The violence Choi halted in one room directly fueled the death in the next. The medical team stops moving. They stand among blood-soaked gauze and discarded surgical gloves. There is no triumph in the survival of the boy, only the weight of the woman now lying under a white sheet. 3-month-old Alicia arrives at the emergency room in total respiratory failure. Her muscles are flaccid and she cannot draw breath. Dr. Manning performs an emergency intubation, forcing a tube into the infant's airway to establish a mechanical lifeline. Despite the intervention, the baby remains neurologically unresponsive. In the same ward, a boy named Timmy has waited 8 months for a heart transplant. His condition is terminal. Dr. Rhodes monitors Timmy's failing vitals and identifies Alicia as a potential donor. He approaches Manning with a cold calculation, requesting she speak to Alicia's parents about harvesting her organs. To Rhodes, Alicia is a lost cause. To Timmy, she is the only hope. Manning faces the pressure of declaring a patient dead, while another doctor waits for her heart. The diagnostic path points toward brain death until Manning notices a physical detail. There are fresh grass stains on the parents' pants. She questions their routine and learns they place Alicia on the grass for tummy time every day. Manning immediately halts the organ donation protocols. She orders a toxicology screen, looking for a specific chemical culprit. The results confirm infant botulism. Toxin from the soil has paralyzed Alicia's nervous system, mimicking the symptoms of brain death. Manning administers the antitoxin to neutralize the poison. The paralysis breaks, and Alicia's muscles regain function. She is not a donor, she is a survivor. Alicia is saved from a premature autopsy, while the medical team continues the search for Timmy's heart. Olga, 74, is admitted to the emergency room with heat stroke. The medical team stabilizes her, but lab results reveal a specific abnormality. Her blood contains dangerously high levels of taurine. Dr. Choi and Dr. Charles identify the source. Olga has been eating cat food for months. She is severely malnourished, her body wasting away despite her refined appearance. The investigation uncovers a darker trade. Olga deliberately skips her essential heart medications. She sells her prescription, painkillers, and sedatives on the street to generate cash. She does not use the money for food or rent. Instead, she buys luxury designer handbags. To Olga, the image of wealth is more vital than her own physical survival. In the hospital ward, Olga's neighbor Ruth arrives. The visit is not about comfort, it is a display of status. The two women immediately begin comparing their expensive purses, checking the leather and the labels. They perform a script of high society elegance while Olga's organs fail from lack of protein. The tension breaks when Ruth makes a quiet confession. Her own luxury bag was a gift from her son. She admits she has no money of her own. Olga stares at her, realizing the competition was a hallucination. Both women are living in absolute poverty, starving themselves to maintain a lie for an audience of one. They are trading their health for leather goods, clinging to a social dignity that has already vanished. Pride is the only thing Olga has left, and it is killing her. 8-year-old Phoebe is rushed to the emergency room after suddenly losing her hearing. Dr. Manning orders a CT scan to locate the cause. The images reveal multiple healed skull fractures and old bone breaks scattered across the girl's body. The medical team immediately flags the case as child abuse and alerts social services. Confronted with the evidence, the mother, Michelle, breaks down. She admits to kidnapping Phoebe and living under a false identity for years. She tells the doctors she fled to protect her daughter from an abusive father who she believed was responsible for the injuries. However, Dr. Charles notices a new symptom while Phoebe tries to color in bed. She cannot grip her crayon, her hand has gone weak. He orders specialized blood tests and a bone density review. The results confirm Phoebe has osteopetrosis, a rare genetic disorder that makes bones abnormally dense and extremely fragile. The deafness is a direct result of bone growth compressing her auditory nerves. The fractures were not caused by violence, but by the disease itself. The realization hits Michelle with crushing force. She uprooted her life and committed a felony to escape a man who was never a threat. Despite the medical discovery, the legal report is already filed. Detective Olinsky and uniformed officers enter the ward and pull Michelle away from her daughter's bedside. Michelle is handcuffed and led through the hospital corridors. Phoebe's screams for her mother echo through the emergency department as the police take Michelle to jail, leaving the medical staff to watch the fallout of a sacrifice built on a misunderstanding. Candace Mason enters the emergency room following a low-speed vehicle collision. A hospital volunteer intercepts her stretcher, praising Candace for her influential blog about battling lupus. The volunteer expresses sympathy for Candace's current flare-up, a condition Candace has publicized online to her millions of followers. Once alone with Dr. Scott and Dr. Holstead, the facade breaks. Candace confesses she has been in total remission for 5 years. She maintains the lie to protect her social status and ensure the continued flow of donations. The doctors review her website, which depicts her as bedridden and suffering. They suspect financial fraud, believing she is pocketing money intended for lupus research. Dr. Scott prepares to discharge her, but a factual discrepancy emerges. Candace admits she never saw the car coming from her side. Dr. Scott suspects peripheral vision loss and uses the hospital's tracking system to justify a deeper neurological exam. An MRI reveals a lethal irony. The labs confirm that the lupus is no longer a performance. It has become a reality. The disease is actively attacking her brain and optic nerves, causing severe inflammation and optic neuritis. As Candace absorbs the diagnosis, her online world collapses. Her followers have uncovered her years of deception and are flooding her social media with vitriol. She is now facing a genuine medical crisis, but her history of lies has stripped her of all credibility. The community she built on a fake illness now abandons her as the disease truly begins to kill her. Jim Foster, a prominent hospital donor, arrives at the emergency department with his wife. His reputation for generosity is immediately contradicted by his volatile temper. During a routine examination, Jim's behavior turns predatory. He corners Dr. Hammer, making crude remarks about her physical appearance and age. When she demands he let go, Jim grabs her forearm with excessive force. The situation escalates into a public confrontation. Jim shouts insults at the medical staff, threatening to immediately revoke his multi-million-dollar funding for the hospital's new hematology center. To the witnesses, he is a powerful man, using his wealth to excuse his abuse. Dr. Hammer looks past the aggression and focuses on physical symptoms. She notes Jim's complete loss of smell and his sudden lack of physical coordination. She orders an urgent CT scan. The imaging reveals a massive olfactory groove meningioma. The tumor acts as a physical intruder, crushing Jim's frontal lobe and stripping away his social inhibitions. His brain can no longer process right from wrong. The philanthropist's personality has been hijacked by a growing mass of cells. Jim is rushed into surgery to resect the tumor. As the pressure on his brain subsides, his cognitive functions stabilize. Following the procedure, the aggressive facade vanishes. Jim regains his composure and realizes the gravity of his actions. He meets with Dr. Hammer, offering a sincere apology for the harassment caused by his pathology. The medical facts have cleared his name, proving that a hidden biological malfunction was the true source of the hospital's crisis. Gunshots interrupt a neighborhood basketball game, instantly shifting Dr. Scott from athlete back to first responder. He identifies the source of the fire and moves toward a derelict warehouse. A police officer attempts to block his path, warning him that he is unarmed and no longer on the force. Scott ignores the protocol and enters the building alone. On the third floor, he finds a young boy named Michael collapsed on the concrete. A stray bullet has punctured his abdomen. Michael is wearing a superhero mask. He was playing a game when the reality of street violence intervened. Scott drops to the floor, using his hands to plug the hemorrhage. The boy's eyes begin to roll back. To fight the onset of shock and keep the child conscious, Scott abandons medical jargon for a tactical lie. He tells the boy that the upcoming surgery is a cover for a secret procedure to give him superpowers. The boy is stabilized and rushed to the trauma unit at Chicago Med. Scott stays in the bay, his clothes soaked in blood, until the surgical team takes over. The operation is a success. Hours later, Scott visits the recovery room. The adrenaline of the shootout has faded, replaced by the quiet gravity of a mentor. He looks Michael in the eye and delivers a final lesson. Guns are not toys, and no real superhero requires a weapon to be brave. By saving the boy, the former detective completes his own transition, proving that his most effective tool is no longer a service pistol, but a scalpel. Dr. Holstead walks through the hospital corridors with Dr. Cooper, deliberately projecting a sense of defeat. He mentions a high-stakes poker game where he lost everything. He lists his financial burdens, medical school loans, mounting credit card debt, and overdue payments. He asks about picking up extra graveyard shifts, making it clear he is desperate for cash. Cooper watches him, noting the vulnerability. Later, Holstead meets privately with hospital director Sharon Goodwin. She presents her findings on Vascom, the company behind the cardiac monitors. Her investigation has uncovered a network of shell companies using stock photos and overseas call centers to hide illegal activities. However, they lack the internal ledgers needed to prove the connection to the kickbacks. Halstead reports that he has successfully established his cover as a bankrupt doctor. The trap is set. In the hallway, medical representative Jessa Rinaldi approaches Halstead. She tells him that Cooper spoke highly of his work. She attempts to explain how the Vascom device measures cardiac output, but struggles with the medical terminology. She quickly pivots to the real offer. She wants Halstead to act as an influencer, promoting the monitor across different departments. In exchange, the company will compensate him for his time and effort. Halstead maintains his desperate persona and expresses immediate interest. Jessa smiles and hands him her card. By accepting the bribe, Halstead officially infiltrates the criminal network, securing the position needed to dismantle the corruption from the inside. Roland stands in the center of a crowded street, trapped in a mental breakdown. Police officers surround him, hands on their weapons, shouting commands. The situation is seconds away from a lethal escalation. Dr. Scott, a former officer turned physician, steps into the line of fire. He ignores the drawn guns and focuses on the boy. Using a calm, steady voice, he de-escalates the tension and guides Roland into an ambulance. At the hospital, Dr. Charles observes the patient. Roland describes his symptoms. He sees dark shadows following him, but he hears no voices. Dr. Charles notices Roland's body is rigid and his movements are slow. He checks the medication list. Roland is taking 30 milligrams of flufenazine daily. It is a massive dose of a first-generation antipsychotic, typically reserved for violent cases of schizophrenia. Dr. Charles and Dr. Scott review the medical records and find a pattern of systemic bias. The previous psychiatrist saw a young black man in distress and immediately labeled him dangerous. Schizophrenia was the convenient diagnosis used to justify heavy sedation. The high dosage did not help. It triggered physical stiffness and exacerbated his mental state. The doctors call Roland's mother into a meeting. They present the facts. Roland does not have schizophrenia. He has bipolar disorder. The shadows were a result of extreme sleep deprivation and incorrect medication. They explain that data shows black men are disproportionately misdiagnosed with schizophrenia compared to white patients. The doctors stop the flufenazine and start a targeted treatment plan. Roland's body finally relaxes. The shadows disappear. He is no longer a threat to be managed, but a patient finally receiving the correct care. A pneumonia patient develops acute respiratory distress syndrome. His oxygen saturation drops to critical levels. Dr. Cooper arrives and takes control of the treatment. Dr. Holstead expresses doubt about the aggressive plan, but Cooper ignores him. He relies entirely on the VAS-COM, an expensive hemodynamic monitor to manage the patient's fluids. Cooper decides to perform a high-risk lung recruitment maneuver. He increases the ventilator's positive pressure to force open collapsed alveoli. After 30 seconds of tension, the patient's oxygen levels begin to rise. The patient stabilizes, and the family thanks Cooper for his expertise. However, the victory is short-lived. Another patient, Eleanor, dies suddenly from a massive embolic event. Holstead investigates the cause of death and finds a disturbing pattern. Eleanor was also monitored by the VAS-COM. Holstead discovers that the device increases the risk of blood clots in hypercoagulable patients. He realizes that Cooper is a paid consultant for the company that manufactures the VAS-COM. Cooper has been overutilizing the device on patients who do not need it to secure kickbacks and consulting fees. The machine Cooper claimed was essential for survival is actually a deadly liability. Holstead confronts the reality that a senior doctor is prioritizing financial gain over patient safety. The recruitment procedure was not a medical necessity, but a calculated move to protect a lucrative business relationship. Cooper's reckless promotion of the technology has turned the hospital into a profit center at the expense of human life. Dr. Dylan Scott admits a female motorcyclist named Melena to the emergency room following a high-speed collision. While searching her belongings for identification, Scott discovers a heavy, black-wrapped brick of high-purity heroin. His medical duty immediately clashes with his instincts as a former police officer. A man claiming to be Melena's cousin arrives, but Scott notices a specific tattoo on the man's neck, identifying him as a member of the Serbian mafia. The tension escalates when Lieutenant Regina Jeffers from the narcotics division arrives at the hospital. She ignores Melena's medical condition and demands her immediate discharge, pressuring Scott to violate standard protocol. Scott recognizes the patterns of a high-stakes operation. He knows the narcotics division is protecting a specific asset and refuses to let a critically injured patient walk out. When Melena's injuries worsen and she returns to the hospital struggling to breathe, Scott confronts her in private. He does not ask about the heroin or the mob. Instead, he reveals his own past, showing her a photograph of his police academy graduation. He tells her that he was once a cop and still bleeds blue. Melena's defensive posture drops. The silence between them confirms the reality. She is an undercover officer embedded deep within the Serbian mob. Scott decides to protect her secret. He provides the necessary medical care while ensuring her cover remains intact, acting as her silent ally within the hospital walls. The doctor and the agent share a quiet understanding before she returns to the field. Dr. Will Holstead sits in a boardroom where lawyers deliver the final verdict on a corporate medical scam. For whistleblowing, he is awarded $1.2 million. The celebration is short-lived. A hospital administrator informs him that Sharon Goodwin has already pledged her entire share to the hospital's charitable foundation. They are organizing a press event for the end of the day to announce the donation. The trap is set. Will is now expected to hand over his windfall or be branded as the doctor who chose profit over the mission. The pressure intensifies in the hospital corridors. Sharon tells Will she didn't do it for the money and assumes he shares her altruism. She calls the public donation an opportunity to send a strong message to the staff. Will remains silent. He is not a saint. He is a man facing a financial collapse. He corners Sharon in a hallway and tells her the truth. Her public generosity has forced him into a no-win situation. He is drowning in debt and needs the money to stay afloat. Sharon does not budge, telling him his personal issues should not interfere with his work image. The cameras are ready and the podium is set. A colleague mocks Will, asking if he is ready to accept the Mother Teresa Award. Will looks at the stage and makes his choice. He ignores the cameras and walks the other way. He tells the colleague directly that he is keeping the money. He refuses to sacrifice his survival for a hospital PR stunt. He leaves the building, choosing his own life over a manufactured reputation. Abby Carpenter enters the emergency room in a hazmat suit, her body covered in bloody, self-inflicted sores. She insists invisible mites are burrowing under her skin and laying eggs. She has shaved her head to stop the infestation, but the itching remains relentless. Dr. Charles reviews her medical files and discovers she stopped seeing a psychiatrist when the pandemic began. He realizes that telling Abby her condition is a mental delusion will only cause her to flee. To save her, he chooses a strategy of benevolent deception. Charles sits by her bed and adopts her logic. He presents a pill, claiming it is a targeted medication designed to kill the larva. In reality, it is a potent antipsychotic meant to block dopamine receptors and break the brain's delusional circuit. He asks for her trust, and Abby swallows the medication. Hours later, the phantom itching stops, and Abby's logic returns. She quickly notices Charles's lab coat, identifies him as a psychiatrist. She realizes the mite medicine was a lie, and her relief turns to anger. Charles does not retreat. He explains he was not afraid of her anger. He was afraid she would leave the hospital untreated and spiral further into permanent madness. He validates the extreme isolation she felt during the lockdown. His directness de-escalates the tension. Abby stops fighting and agrees to meet with a psychological specialist to begin real treatment. Her year-long cycle of paranoia finally ends. 10-day-old Kayla is dying from necrotizing enterocolitis. Dr. Marcel removes the dead tissue from her small intestine, leaving the infant with a digestive system that can no longer sustain life. A transplant is her only biological solution. In the same hospital, a woman named Rose is brought in after a car crash. She is brain dead. Surgeons perform an emergency C-section to deliver her 2-week-old fetus. Baby Tyler is born without a heartbeat. The medical team restores his pulse, but the lack of oxygen has already caused irreversible brain damage. Tyler is declared non-recoverable. His grandparents, David